Hello and welcome to Bring On the Medicine, a holistic healer summit. My name is Janae Robinson. I am the owner of Janae's Essentials in Burley, Idaho. I am a life coach, a yoga therapist, and the host of this summit. I am here with Eliska Mirvald. Eliska has been passionate about health-related issues all of her life. She graduated from the University of Utah Physician's Assistant Program in 1991. She spent the next 40 years practicing clinical and surgical settings. She has always been interested in alternative therapies, many of which she tried herself. She found that craniosacral therapy really spoke to her and decided to study at the Upledger Institute in 2017. She's been practicing and expanding her knowledge through craniosacral courses ever since. Her practice includes working with adults suffering from a variety of health issues, infertility, pregnancy, newborns, and children. She finds most satisfying helping infants and children feel the best in their bodies, relieving tensions which could affect them for the rest of their lives. Eliska loves learning. She has been doing that all of her life. She knows the importance of balance in mind, body, and spirit. She has been involved in a variety of teachings, self-improvement studies like Tony Robbins seminars, the forum, yoga practices, meditation, etc. And she is a certified life coach through Cloe Madanes coaching school. Eliska enjoys many activities, reading, watching movies, traveling, outdoors, but most of all, spending time with family and friends. So help me welcome Eliska. Hi.
Hello, hello.
Thank you for joining me today. I'm very excited for this interview. And I wanted to ask you, what got you started in craniosacral therapy?
Well, thank you for having me and for putting together this amazing seminar. It sounds like you have some amazing people in it, and I can't wait to listen to it. So I'm excited. Okay, what got me started? Well, probably like most people, um, I was having some difficulties oh, kind of about 10 years ago when I was still practicing as a PA. And the difficulty was with burnout. I was just kind of done with my practice, and the healthcare was changing, and it was really difficult for me to continue working in that environment. So I started looking for alternative, something to relax me, something to help me along. And I remember long time ago being at a dentist office and having my very first craniosacral therapy. And it was amazing. And so I started looking for practitioners. At that time, I was living in Salt Lake City, and found out, signed up, and I found it just super relaxing, super calming, balancing, rejuvenating. And I was so excited about it because it was such a gentle touch therapy that I decided to study it. So yeah, that's how I started.
Yeah, so this is really interesting. So you were at the dentist, right? This is really interesting to me because I've had one of your sessions in your studio. And so what does a session look like? Like I'm trying to imagine, what does a session look like if you can have this done at your dentist's office?
Well, he used only few movements, and the movements he was using is to relax people. And there are certainly we can certainly do that. So craniosacral can be done. People can be standing up, they can be sitting, they can be lying down. It just really depends on the situation. But the most kind of best way to do it is when people can lay down and relax. They are fully clothed, they are covered with a blanket. We want them to be really relaxed, and it's a gentle hands-on treatment that makes you super relaxed. this day and age, it is so important to help people get from the sympathetic, the fight and flight condition that we generally carry all the time, to the parasympathetic, the relaxed state where things heal and everything in the body works better. The session can last from hour to 2 hours, depending what the client wants. And I basically move my hands in different directions. And sometimes people say, well, what's the difference between Reiki and craniosacral? And there is a big difference, because in craniosacral, we actually use the body's response to our hands as a guide. And the body is very receptive and very willing to release the tension and to move. And it's really amazing to feel that. The session usually starts with review of the client's history. And also, I like to know what is their intention for that specific session, and I also have an intention for them, which is sort of parallels their intention. And then afterwards, when the session is done, we kind of review what I felt and what the patient felt. And sometimes it's quite surprising what people experience during that session, as you probably know.
Yes, I do. I really enjoyed my session. I really it. And I was surprised, because to me, it did feel a little bit like Reiki. I could see the similarity for sure. And, but I did notice that you were talking about different organs in my body, and there were certain things that intuitive knowing that my body was giving to you, so that you could relay that to me in some way. And so and also I am so petrified at the dentist. I would love to find a dentist that offered that relaxation, because we do need to. We're not a culture of relaxation. We are 24/7. Let's go.
Go. Yeah.
We love that too. And then I was also very interested, because when we had our initial discussion about what it was that you did, you had talked about your love of working with pregnant women, with babies and children. So could you speak a little bit about that?
Sure. Well, I feel like with pregnancy, with the mom and the baby still in the womb, you are working on two people, basically. And you can make such a big difference in the whole pregnancy by relieving the morning sickness, back pain, balancing the hormones, whatever the issue is that the mom is experiencing, but also connecting the mom to the baby, teaching them to talk to the baby, telling them what's going on, so they are aware of it. If the mom or the family is going through a lot of trauma or something bad is going on, making sure the mom tells the baby what's going on, so that the baby doesn't absorb it. Because of course they are aware of everything, especially what the mom is going through, everything, even though it's muffled, they are aware of the surroundings. And so I think it just sets the baby for the best life, and the mom for the best delivery. And then having a baby that really knows that it's cherished and being taken care of, and being part of the discussion, because the mom can get really in tuned with the baby and can sort of sense what the baby wants. And sometimes it's interesting what actually the baby's answer is, and the mom knows, so it's pretty lovely. And then with craniosacral can help during delivery. We can actually induce labor, if we are asked to. There are some certain maneuvers that you do in the pelvis that can start labor. The labor in general is easier because, again, of the relaxation. When mom is much more relaxed, she can handle pain much better. The baby moves better through the birth canal, and through all those changes. So it's really very helpful for everybody, not just mom and the baby, but also dad and the rest of the family. And then with newborns, if they had some trauma, if they had some tightness in the body left from the delivery, we can release that very easily. Now, I'm not the only one who does that. That can be released by chiropractors who work with babies, or occupational therapists. They sometimes do that. So with the newborns, there's a variety of people who can do that. You can manipulate the misshaped head, which is a good idea because any abnormal pressure on one side or the other can affect the baby's nervous system. Lately we see a lot of babies, the banana babies, who are arched. They can't really relax. They can't go like that because of the tightness, or they have tightness on one side or the other. Their neck might be a little bit tight. And that can all be released and made, so you can make them really much more comfortable. You can teach the parents what to do. It's really great if you can teach them and they do the maneuvers themselves at home, because then the healing happens faster. And babies are wonderful. Their bodies are so soft and easy to manipulate that they really respond quite well. And then everybody's happier. When the baby's happier, everybody's happier.
Oh, for sure, for sure. And I'm hearing this beautiful connection between baby and mother during pregnancy. So this beautiful connection that starts to happen, and then they're approaching this delivery as a team, really, right? They're a team. So if they've been in communication, they're working as a team to work through this delivery. And then afterward, I think both bodies go through quite a lot during delivery.
Absolutely, and the hormones, and it's really amazing. And also, if a mom decides to have somebody like me during delivery, we make a plan ahead of time. We make a plan. What does she want to happen during delivery? I am not there to manipulate the system or do anything, be in the way, but I know what her wishes are, and I can communicate that a little better for her than, let's say, she might be in pain, stressed out, she may not feel like saying what she really wants. And so it's good to have somebody, whether it's a doula or somebody like me, there to communicate her wishes to the doctor, because sometimes they maybe it was communicated during a visit, but the doctor forgets, how the mom wanted to be done. For instance, I don't want the cord cut immediately. I want to wait, 5 minutes before the cord, and things like that, which kind of it's such a chaos, sort of, that everybody forgets. And the doctors and nurses, they are just doing their routine. They don't mean to, but if there's somebody who's sort of stepping back and just going, hey, this is kind of what we discussed and what mom's and dad's wishes were, then it can make a big difference.
Yeah, it sounds like such a supportive modality to take into delivery. Yeah, very supportive.
Yeah.
And I think too that because you were talking about even the father, right, learning these techniques, even the father has a stress level when
absolutely
he's seeing things that are happening, he's hearing things that are happening, but he has no control. He's not delivering that baby. He's not the nurse or the doctor. So I could see where that could really just bring down the stress level during that delivery.
Yeah.
which is beautiful.
Yeah, it can. And the dad, it's really important. We can do craniosacral on him to get him de-stressed. And that's kind of nice too, even before the delivery. And I think because mom is better balanced, if we do couple sections before delivery, everything goes better. There are also some maneuvers to release the medication from mom's body. If she had narcotics, if she had, epidural, and that also affects the baby. So there are maneuvers to help to get the narcotics out of the system quicker. So it's pretty amazing. It's pretty amazing. Yeah. And then everybody feels better. Like I said, baby feels better, so everybody feels better.
For sure.
Yeah.
Why don't we talk about the different levels? So there's this physical level, there is emotional levels. What does craniosacral encompass there? Is it just physical? Is it just the stress levels, or is it emotional?
Well, all of the above, really. So the craniosacral therapy works with the craniosacral system, which is the head. I have a little model here.
Oh, yeah.
And the spine, also the spine all the way to the coccyx. And inside is also, of course, the spinal cord and the brain. And that's surrounded by dura mater and fluid. And the fluid and the dura mater, they nourishes and take away waste and protect the brain from the skull, right? Well, if those soft linings are damaged in any way from some trauma, if there's some pull, and it could be, the pull could be in the lower back, and you may have headaches from that because the whole hydraulic system is under tension. And the system, those membranes in the spinal cord, actually they move, and they move very slowly, rhythmically, kind of like peristalsis of the bowel, as it moves the food through our bowel. And it's kind of similar. It's very slow, and that movement can be palpated. And that's what craniosacral therapy does. We can feel this rhythm anywhere in the body, and we can evaluate it. We can feel if it's strong, if it's weak, if it's stronger on one side than the other, if it's irregular. And then we can go through the body and do certain releases of fascia, which is the second part of the that the cranial system works with, is the fascia. And fascia is a tiny white lining that lines the muscle, the organs. It's everywhere. It sort of communicates with each other. You've probably seen it in a meat, when you buy meat, that sometimes certain meats that have that little white lining around it. And so that's what fascia is, and it connects the whole body. And again, one thing affects the other. So there are certain manipulations where you release the fascia. The fascia goes up and down, but also some go this way. So we make sure that especially the horizontal ones get released. Through studies, they actually found certain maneuvers for certain conditions. So, for instance, if somebody has or had a stroke, usually there is some tightness in this thoracic area, and also back here in the back of the head. Or depression, depression that has really no cause. I mean, we get depressed if something bad happens, somebody died, we break up, but people oftentimes have depression for no reason. And there are certain maneuvers that are known to relieve that in about 50% of cases. So that's a lot. That's a pretty good number. And when I say, we are feeling the body Well, the body gives us, so it's not just the rhythm of the craniosacral system that gives us clue, but also if there is an issue somewhere, let's say congestion or tightness, you can feel a pulse, you can feel suddenly kind of chaotic energy in that area. And that you basically wait till it gets released. Because the body is self-healing. The body can heal itself. It will do the job if you kind of nudge it, if you give it space to do that. And everything can be done very gently. Not always, but most of the time it can be very gentle. It also covers the emotional part. So if we have emotions stuck somewhere in the body, let's say somebody got hurt as a kid, let's say they banged up they fell on their bum and they got really upset about it, or they were really upset about it. Well, the upset, the emotion, the anger could be stuck with the injury. Now, then when that person was a kid, they recovered pretty quickly, didn't think much of it. Years later, that stuck energy starts causing issues. And that needs to be released. And I'm not saying that craniosacral is the only therapy that does that, but there is a good chance that we can release it, not just that tightness in the tissue, but also the emotion. One of the biggest really, or most impressive releases of something like that, or really bad trauma I experienced, was with sexual abuse. And there was just lots of anger, and yeah, that was those are quite impressive. You know how much of that is really contained in that body. We call it the energy cyst because it's in a kind of locked in an area, and the body walls it off because it doesn't want to cause chaos in the rest of the body, so it sort of walls it off, but it can only keep it walled off for a certain amount of time till it starts causing problems. And the problems could be anywhere else. Let's say you injured your shoulder. As you got hit in the shoulder, the energy travels and slows down, the trauma, and it oftentimes gets lodged in the lungs. So years later, people start having lung issues or coughing all the time. And it could be from an injury a long time ago. And sometimes it's not even a major injury, or trauma. People kind of forget about it. And then as we start working on it, they start remembering, oh yeah, this is what happened when I was this age. And yeah, I was upset, or I was whatever. So very interesting stuff.
I think so too. And what's coming to mind right now is there is a man named Peter Levine, and he works with a lot of emotions and different things. And I am not certain the book that I'm reading with him. It might be, I'm not sure. I'm not even going to throw anything out there. But he talked about how he was involved in a car accident. He was a pedestrian and he was hit by a car. Mm-hmm. He said that the way that our nervous system works and that our body works, that if we have a traumatic event, so it could be sexual abuse, it could be an injury, like you said, mm-hmm. if we are not brought back to baseline within our nervous system, it can create PTSD, or that mm-hmm. that extends through. And so I'm thinking, mm-hmm. how many times did I fall off my bike and I just had to get back up and keep going, mm-hmm. where we are not processing through those emotions. So how many do we have stuck in our bodies? And then, I'm 59. I'm thinking, no wonder I feel this way or that way. Mm-hmm. No wonder my liver is sending you these messages. Mm-hmm. And so,
I don't think that every time we get hurt, we store it. Some stuff just goes through and it's fine.
Yes.
You know, we release it.
Yeah, it's
So
baseline. If we're not brought back to baseline, then it does have that ability to stick with us.
mm-hmm,
And I think
mm-hmm.
most of the time, you know, we can stay regulated.
Yeah, yeah.
But it's very interesting to see how much that we actually are carrying that we don't realize until someone starts to feel into our systems,
Mm-hmm.
right?
Yeah.
Yeah,
And also with these therapies too, you know, you can actually feel stuff that is not an issue yet. You know, there's some energy like in your liver. You don't have any issues with the liver, no symptoms, but there was some energy that needed to be released. And I don't know whether it was something just now or a long time ago. I mean, who knows? And we don't necessarily have to care about that. If nothing came up, we can let it be, you know, and just the energy get released and we are okay. But we can sort of prevent further issues. So even for people who sort of in a way don't have any problems, these therapies are very helpful because of the relaxation and because of the prevention in a way, you know, and getting back into the parasympathetic relaxation that makes a big difference. That's when we heal and we feel better and balance the body, balance the nervous system, and you know, it makes us function better. So it's
absolutely.
the self-care, you know.
Yes, yes, that's what it is. It's
Mm-hmm.
self-care.
Mm-hmm.
It is a beautiful service. And it does, at least it left me in such a wonderful state of relaxation,
Mm-hmm.
of completeness and wholeness. I felt very connected to my body. I felt very safe in your care. There were so
Thank you.
things that I just
Mm-hmm.
enjoyed about that.
Mm-hmm.
So I wanted to ask you, can you speak of any type of spiritual experiences or spiritual medicine that you've experienced that your clients have experienced or
My
expressed?
client, I think it's more pronounced in people who have done a lot of meditation, shadow work, you know, who are sort of the seekers, then they are more likely to experience that. But not necessarily. I've had a client just last week who really surprised me quite a bit that she had sort of an experience. And I would say for those people, it's more of a bonus. I don't think that I'm necessarily seeking to induce that, but because of that deep relaxation, things like that can happen. You get some people see colors, some people see kind of suddenly like a movie coming through, you know, some people see their guides, spirit guides, or relatives, past relatives, like you did. So it varies. But I think because we induce with the maneuvers such a deep relaxation, it's actually relaxation that you want to obtain when you meditate, you know, and your mind is blank. You move to the next realm, sort of. It's like the time just before you fall asleep or just before you wake up, where you can experience some spiritual encounters, you know, or pass into the other realms in a way and remember it, which is nice because a lot of times in dreams we don't remember it, you know, if we go there.
True. Well, and
Yeah.
I wanted to shift gears just a little bit, and
Mm-hmm.
because I know that you've traveled, and so
Mm-hmm.
I just wanted to know personally, what has been your favorite travel memory so far?
I don't know that probably the most impressive was when I was in Thailand. Because of the culture, because of wonderful people, the kindness, and everybody was so soft-spoken, you know, and sweet and helpful, and without an effort. You know, sometimes you can tell people are just trying. Let's say they don't want to be there, but they are really trying to be hard, and you can sense it. Um, Over there, it was just effortless. The culture was totally new to me, so that was very interesting. So that was probably most impressive place that I have been to so far, because it was so different, and the history is so different. Um, the other place that I was quite wowed about was southern Spain, Andalusia area, where the Muslim culture and Christian culture mingled back and forth, and the Jewish culture in it. And you know, you have these cathedrals that used to be mosques that were just then changed to a cathedral, and also the history of it, how for many centuries they lived in peace, and it was possible, you know. So
Yeah,
so that was pretty impressive. Yeah, I like that. And
that's
also seeing, you know, the areas where they filmed the Game of Thrones, you know, several places were filmed in Spain. So that was fun. It was just fun. But I enjoy every place we go to. I try to go to different places every time. So um, I just enjoy seeing people and how they live and what the culture is about. Unfortunately, I'm gonna have to change it a little bit up, because most places are so touristy now
right.
that you kind of lose that connection with the locals. And so I may have to just come up with some other ways to travel, so we are not always in those busy touristy areas, you know. I mean, it's still gorgeous, you still see the buildings and stuff, but the natives are gone, you know. They are just working in the restaurants and stuff, and nobody lives there anymore. It's all for tourists, so that's kind of sad. I'm really sad about that. And so we'll see where we go next.
Yeah, I understand that too. For sure. A lot of places that you go are that way. And so you just
Hmm.
have to get creative. I've just,
Hmm.
I'm going to explore the United States. There's a lot of
Hmm.
culture even here. So
So many.
yeah, that would be a fun thing to do as well.
Yeah, yeah. Oh, absolutely. And nature here, there's such a big variety. You know, I lived in Utah for 40 years, and it was just the desert, southern area of Utah was breathtaking, and I miss it. But I love the mountains, I love the trees and the greenery. So, I mean, every place has something. I mean, it's not
True.
one thing or another, you know.
So true. There's so,
Hmm.
and I think if you go and you're appreciative of what is there and
Hmm.
moment and connecting with people and nature, that you just can't go.
Hmm. Yeah, yeah. It's a
And
lot of fun. It's a lot of fun, but it's good to be home too.
yes, for sure. So
Anyway.
I wanted to ask you with sacrocranial work. Are there any certain conditions that people might have that would seek you out, or any certain types of like injuries that you help with?
You know, it's pretty much good for any kind of condition, any chronic conditions, especially people with MS and chronic pain, nervous system disorders, depression, anxiety, PTSD. It's very good for children with attention deficit disorders. You can really make a big difference with this, because they tend to have the frontal lobe kind of pushed back a little bit. Oh, that was one thing I wanted to mention too.
Yeah.
Let me finish this, but then I want to go back to it. People with scoliosis, chronic fatigue, TMJ. Also, TMJ is quite, yeah, you can make a big difference. post-surgical, again, because we cause such relaxation, you can tolerate pain much better, and pain can be very stressful, and when you are stressed and tight, you don't heal as well. So there is really no condition that it's contraindicated with. Well, there is one, actually. If somebody has aneurysm in their head, not a good idea to do it, because we can increase pressure as we move the fluid. Yeah, that can cause trouble. But other than that, there's really nothing.
That's great.
Yeah. Mm-hmm.
And you had a thought that you were thinking of that you wanted to get back to. So I wanted to give you some space for that.
Oh, yeah. So the craniosacral, why I liked it so much, back to that part, was because we work on the head. And as you can see, the head has several different bones, and they are connected with joints called sutures. And those bones can actually be manipulated. So if there is, of course, these manipulations are, tiny, millimeters, really, that's all it is, but it makes such a big difference with the pressure on the nervous system. We also can work in the mouth. And what we know is that if kids had a lot of trauma when their second teeth were coming in, it would be stored in the teeth. So we can work with that. We can also work on kids who have teeth that don't fit in. We can actually enlarge it, with several treatments and work in the mouth. But then it's kind of hard for the kids to have the work done in the mouth, but that can be also done. Yeah. So that I wanted to mention that because that's kind of an important one, and that's why I loved it so much, because there are not that many therapies that actually work on your head.
For sure. Oh, totally. And so what is one lesson that your career has taught you that you feel that, or that you think that everyone should know?
Well, it is to keep looking. If you have a health issue, and the Western medicine is not giving you answers, keep looking. There is so much out there that's available, and you never know what's going to make the difference. And so I would encourage people just trying different things, and also nothing goes to waste. So whatever you have done, and even though it helped you just very little, it stacks up, and you are getting closer and closer to being healthy. And I feel like it can be done, because the body is self-healing, and with the right intentions, you can really find your way to feel much, much better, and put certain things in remission, and heal yourself, heal many things. I love this time when we live, because there are so many possibilities, and people are taking control of their health, and I love it. They are looking for their treatments, what fits them. It's no more one size fits all, and people are responsible and doing their stuff. I love it.
I do too. I love that. And I love what you said, that nothing goes to waste. And I take a moment and just have everybody pause and just remember that, like, nothing goes to waste. If you're actively seeking and have that healing intention, it's like, I've never heard that before. And that just really went right to my heart. So I appreciate it.
I realized that, I think, when I was raising my kids, because sometimes you feel like, oh my gosh, what am I doing this for? Or when I see parents being frustrated and all that. No, just keep doing the right thing. What's best for your kids, and it will come back. Maybe they deviate or whatever, but it does not go to waste. Yeah,
that's great advice. And where can people find you? How can they get a hold of you if they want more information or they want to book a session with you?
Well, the best way is to message me or call me, and my phone number is 801-598-4927. Or I'm on Facebook. You can message me through Facebook or Instagram. So those are the best way.
And
or through you.
Yeah, or through me. That's right. You could actually contact me. I do have her number, so that is true. And I would be happy to
Thank you.
send anybody your way. And Eliska, is there any last words or anything else that you wanted to cover today that maybe we didn't touch on but came to mind?
No, I think we covered it all. I mean, I can go to detail about, how this is done and the studies and the school and all that, but that's for another time. No, we covered a lot of stuff and I'm happy about it.
Awesome.
I think it's a good, people get good idea what this is about. So I'm happy about it.
Yeah, I think so too. I think you covered a lot more than I could even remember. When you're laying there on the table, you're receiving, I'm not the type of person that's trying to, figure out the process. I'm there receiving. So I really appreciate your time today and that, that you did this interview. And I'm grateful that you have an opportunity to share your, I want to say medicine, but medicine.
Well, thank you for having me. Yeah, thank you very much.
Awesome.
Yeah, I'm very grateful.
Great. And so
thank you.
Say goodbye and
yeah, bye-bye.